A patient with the first case of Ebola diagnosed in the United States is now in isolation at a hospital in Dallas, and health officials are trying to keep the public calm as they track down anyone else who may have been exposed. Adrian Gurrola has the latest.
A man who contracted the Ebola virus flew from Lyberia to the United States last month, but federal health officials say the people on his flight are not at risk.
Ebola doesn't spread before someone gets sick, and he didn't get sick till 4 days after he got off the airplane. So we do not believe there's any risk to anyone who was on the flight at that time.
The White House released this infographic Tuesday as it and the CDC downplayed any threat of transmission.
Ebola is not a very contagious disease. It's very deadly and very scary, but it's not contagious. It really only spreads through blood and body fluid, and only when you're symptomatic.
Even so, the ambulance the patient used has been taken out of service, and its crew has been isolated, even though officials say they did take proper precautions and adequately decontaminated the ambulance. The patient has been isolated at Texas Health Presbyterian Hospital in Dallas as the CDC checks to see if he might have infected anyone when he was showing symptoms.
Once those contacts are all identified, they are all monitored for 21 days after exposure to see if they develop fever.
If they do, the CDC will investigate whether they might have infected anyone as well. Adrian Gurrola, NAZ Today.
And the latest update from health officials in Dallas now suggests that the infected man remains critically ill and is still in isolation at the hospital. As for the CDC, the main priority will be to track down that small handful of people who had close contact with the infected man after he began to exhibit some of those symptoms of Ebola.